Hello and welcome to your last video lecture on chapter 43, where we are going to talk about cold injuries and disorders of the hair and nails. So starting off with our cold injuries, we have a spectrum. So when we use the term cold injury, it's referring to a skin injury that is caused by an exposure to the extreme cold that could develop in frostnip, chilblains, and all the way up to frostbite. And the areas that are most affected are the fingers, toes, ears, nose, and cheeks. We'll start off talking about frostnip, which you could see a picture of over here, and we'll have cold exposure without tissue freezing here, and it is reversible. It'll start off with a pallor to the skin and pain, and it's followed by redness and discomfort when we start to rewarm that area of the body. If we progress within that cold injury, we are going to get a chilblain, and this is going to be when we have a violaceous skin color, which means that we have almost like a bluish purple, like we see in this third digit over here, going on with plaques or nodules. There's pain present and pruritus, and without ice crystal formation. Now we take this seriously because chronic vasculitis can develop and is usually going to be located in the face, anterior lower leg, hands, and feet. Now, if we progress from there, we can enter frostbite. And this is going to happen when the tissues freeze slowly and the ice crystals begin to form. The skin can start to appear white or yellowish and have a waxy texture to it. And they have numbness with no sensation of pain until the ice crystals start to thaw, and then they are in severe pain. Now, frostbite can be classified by the depth of injury. It could be classified as first degree, which is more superficial and there's just partial skin freezing taking place. It could be second degree, meaning there's a full thickness of the skin with ice crystals. And third degree is deep and includes the full thickness of the skin and the subcutaneous tissue. And there is even a fourth degree, which is deep tissue freezing. And that third degree and fourth degree levels are where gangrene can take place and we have a loss of tissue. Now, sometimes that cold injury is due to a flash freeze, which means we're having rapid cooling of the tissues with intracellular ice crystals associated with contact with cold metals or volatile liquids. Next, we'll get into disorders of the hair, starting with alopecia. This is when we have loss of hair from the head or the body, and it's due to a disruption in the growth phase of the hair follicle. And this could be due to a systemic disorder, such as hypothyroidism or iron deficiency, or maybe the person is going through chemotherapy for a cancer that they have, and it could be due to hormonal or immune reactions. Now, some are going to suffer from androgenic alopecia, and this is localized hair loss that takes place in about 80% of men. It's typically called male pattern baldness, and it's not necessarily a disease, but they are genetically predisposed to losing hair because of their response to androgens. And that's because we have two different types of hair follicles. We have androgen sensitive and androgen insensitive follicles. And our androgen sensitive follicles are going to be found at the top of the head, so back in this area. And the androgen insensitive follicles are found on the sides of the head as well as the back, which we cannot see here. So over time, what starts to happen is those androgen sensitive follicles are transformed into villous follicles, which, if you remember, we kind of have those as a baby, and they grow short, thin hairs. So we start to see that we have a frontotemporal recession, and then it progresses to loss of hair at the top of the head, like we see over here, and there might be a full connection. There is also a female pattern alopecia, which is going to affect women who are genetically susceptible within their 20s and 30s who may experience some genetic and hormonal changes. And we see that there is a thinning and a loss of hair over the central part of the scalp where the hairs are growing a lot shorter and thinner. Another type of alopecia is alopecia areata, and this is an autoimmune T-cell mediated chronic inflammatory disease that's directed against the hair follicles, and it results in the hair loss that we see over here. It's a rapid onset of this hair loss in multiple areas of the scalp, and we see them typically in these round patches. And it could be due to a triggering by stressful events. We have a release of cell-mediated immune cytokines. There could be a genetic susceptibility, and it could be due to a metabolic disorder such as Addison disease, a thyroid disease, or lupus. And regrowth can take place within 1 to 3 months. The hair that is growing within these areas may be very short. They're known as exclamation mark hairs. And to treat this, we could utilize corticosteroids and a topical immunotherapy. Our next disorder is hirsutism, and this is an abnormal growth and disruption of the hair of the face, body, and pubic area in a male pattern that is going to occur in women. And we also even see some frontotemporal hair recession with this disorder. It may be due to them secreting hormones associated with things like polycystic ovarian syndrome, adrenal hyperplasia, or adrenal tumors that then cause hair growth in these androgen-sensitive areas. Now let's get into disorders of the nail. We'll start with paronychia, and this is when we have acute or chronic infection of the cuticle, and this most typically takes place when the hands are frequently exposed to moisture and has bacteria such as staphylococci or streptococci within the area, and occasionally candida can also be present. It causes a painful inflammation here, and an abscess may develop that will require incision and drainage. Then we have onychomycosis, which is a fungal or dermatophyte infection of the nail plate. We can see that it turns yellow or white and becomes elevated, and we start to have an accumulation of hyperkeratotic debris within the nail plate. And the last thing to mention is aging when it comes to our skin. As we age, it's going to become thinner, drier, and more wrinkled. You can see a difference here between the younger skin and the older skin, and that is going to be due to our DNA repair of damaged skin decreases. We also have our epidermal cells containing less moisture, so they start to change shape. And we're going to see that our epidermal pegs are going to weaken the connection between the dermis and the epidermis, and so the skin becomes more smooth, shiny, and has a wrinkled appearance. Contributing to that wrinkling is a loss of elastin as well as collagen. We also have fewer melanocytes that are not protecting us from the UV rays, so we get a greater exposure to sunlight and air pollution that can age the skin, and we get atrophy of our glands, such as our sebaceous glands and our sweat glands, that could cause a drying and flaking of the skin.